welcome to Biztech's C-Suite Conversation Show. Today we have Bijay Singh, the Global Head of Healthcare Business Unit at DKSH. Now, DKSH is an old brand. It's known also as Dietlam Keller Cyber Haiger. It's a Swiss holding company specializing in market expansion services, which essentially is outsourcing. Now, although its headquarters is in Zurich, Switzerland, it is deeply rooted across the Asia Pacific region. Now, to tell us more about this, welcome to the show, Bijay.
Thanks very much, Brian. Pleasure to be here.
Now, Bijay, DKHH, and I used to work for a DKHH competitor, the Zulik Group. Tell us a little bit about DKSH, its history, and your role within the company.
Sure. It's a 160-year-old company. It was founded by Swiss pioneers, which I think the spirit is very much still in DKSH around entrepreneurship. We operate in healthcare in over 15 markets across Asia, plus Switzerland. I say Australia, but it's actually, I say Asia, but it's also Australia and New Zealand. So we've expanded recently. There are 4 business units within DKSH. Healthcare, which is the one that I head, is the largest in terms of revenue and bottom line profit. The other units are consumer goods, performance materials, which is essentially ingredients, chemicals, food product additives, etc., and then a technology division. So essentially what I head is the healthcare division, which serves healthcare clients trying to access patients in Asia, Australia, New Zealand, and we basically support them to access these patients.
Okay, and so traditionally, and we'll zoom in now on your business itself. Traditionally, DKHH supports principals and gives them, as you said, market access, basically expansion services. Outsourcing is nothing new, but there are new trends in outsourcing right now. Walk us through some of those and what are the interesting developments in this space?
Sure. So, originally much of our service was purely logistics and distributions with some client collections and account servicing. What we saw is that our clients needed more. We had various groups of clients. I'd say there's one group that was established in Asia. Many of them simply wanted those logistics services. You had some that were relatively new to Asia or had some presence in Asia, but not in all countries. And in those, they wanted to prioritize certain countries where they would have their own operations and wanted a partner in the others. And then you had a group of companies, which we see more and more, which have never been to Asia and perhaps don't have plans to operate themselves in many Asian markets. And they're looking for a full service partner. So what has changed a lot is that even those companies that are very established in Asia are now relooking at their whole resource allocation. They're prioritizing which parts of their portfolio they should focus on. They're prioritizing which countries they should focus on. And in many cases, they're even themselves looking for a partner in parts of their portfolio, parts of their country. So these are the major changes that have led us to really boost up our presence in many markets and also our capabilities in supporting these clients, particularly with sales and marketing services. I can tell you more about some of the other services that have happened and that we have developed over the years, but really that's been the large trend, is outsourcing of either pure sales and marketing or the entire enterprise or parts of the enterprise.
Okay, and this is interesting, Bijay. So again, you've evolved as a business basically based on client needs, based also on industry needs. And as you were explaining that, I'm thinking to how drug companies in the past And let's just say we're a great group of researchers. We've taken a drug over several years to market. We've started commercializing in the home market, and let's just say it's the US. Traditionally, it's time to sell to a big boy. A lot of times that happens. That's an exit strategy for the investors and stuff like that because it takes a lot of money to scale. So now to what you've just told me is, and it just told the audience, it sets us thinking, say, hey, I want to go to Asia. I don't have huge amounts of money to set up a physical infrastructure, get my drugs certified in each markets, get the distribution done, get sales and marketing done. Let me go and find a partner like DKSH. Is that what you do now, essentially?
I think you summed it up perfectly, Brian. I should hire you into business development for us. Um, Jokes aside, that's exactly it. I mean, if you look at, as you said, a client company, it could be a pharmaceutical, could be medical device, consumer health. A lot of times it's about scale. And what they've determined is several of the larger markets could be the United States, as you said, large countries in Europe, China, Japan, and maybe a couple of the other large markets, let's say Brazil. And they said, okay, the economics makes sense for us to set up our whole sales and marketing infrastructure, which can be very expensive. In other cases, you might have companies that are very well positioned in a certain therapeutic area and get to know certain customers very well. They have a new technology in a completely different therapeutic area, completely different customers. They do not have a pipeline. They do not have a heritage in that. And they look and they say, is it much more economical for us to develop this? Is to develop a market presence ourselves in all these countries? Maybe not. So they will focus on the large ones, develop relationships with key opinion leaders, set standards of care, and then look to partners to help them to get access to those customers who perhaps it doesn't make economic sense for. For example, they may have a very good presence in certain types of cancer, certain types of oncology, maybe in certain types of skincare, but a new therapeutic area comes in, doesn't make sense for them. So that could be a reason why some of the large ones decide. And in case of the small to medium size, maybe some of these markets, incremental revenue for them, but doesn't make sense for them to focus on access. They'd rather focus either on their main markets or in developing new products in the pipeline. I mean, I'll give you an example. A very major company that's been in Asia for over 50 years recently decided to give all of Asia to DKSH. Why? The company is doubling down on development of new assets. They need every cent, every dollar that they can to invest in the development of those assets and bring them to market. So, the CEO and the board decided that that was a better use of their investment than having a wide access, sales and marketing network here in Asia. And they thought partnership is a better model for them.
Okay, I want to be a devil's advocate here. On the flip side of the equation, board members of different companies may say, hey, I'm losing access to the end customer when I give up my sales and marketing. Distribution is fine because there's a back office function. If I don't have access to the end customer, long-term strategically, that's a problem. How do you counter that argument?
I don't counter it at all. What I would say is, what's the right timing for it? In some cases, when you're launching a product, it might make sense to have a partner do that for you. We typically sign contracts when we have these full distribution or full agency that are around 5 years in length. Maybe after 5 years, the client relooks, sees how well we've done, and says, strategically, we're ready to take that back. Maybe they've purchased a new asset in that area. Maybe they've developed one. And they say, this is the time now we want to put our flag down in that country. So we're not talking about in perpetuity. We're not talking about an out license necessarily. although that is also a model that we follow. So if a company is very interested in out-licensing a product, we are definitely interested to talk to them. So that is another part of our value proposition to companies, is to be their full partner, their out-licensing partner in Asia as well.
Now, Bijay, I want to look at another area as well, and that's around innovation in healthcare. Now, healthcare traditionally has been innovating at a relatively slower pace. That's changed in the last 5 years. There's a lot of innovation happening today, and the whole industry is moving a lot quicker. Give us a sense of what are some of the key trends that you're seeing and how DKSH is participating in this innovation.
Sure. So, I mean, I don't think you can talk about healthcare, or you can talk about innovation without talking about digital inroads. And what many people typically see when they think about digital is, for example, telehealth or having a video consultation with a doctor. I think that's just one part of it. Let me give you a few examples of how we've introduced digital technology into healthcare. So one key part is in the area of patient solutions. What are patient solutions? It's essentially to help address issues around access, affordability, education, and persistence or compliance with healthcare. So 4 different problems that can occur in that patient journey. And we figured out how we can use and leverage technology, a cloud-based system, which we have proprietary to DKSH, where we will partner with healthcare clients on a particular product, understand where the issue is. Is the issue around one of those 4 leakage points or touch points, and then develop a program that can help engage patients to comply better, to get better access, to improve education. While there are digital touch points, in many cases, there are also human touch points. So we have nurses on staff where, for example, education is a key part. In many, many countries, patients can only get 3 to 5 minutes with a doctor. They forget much of what has been said within 24 hours of leaving. New questions come up. The doctor doesn't have time to address it. They're calling up the nurse is busy. So clients are very keen for us to partner with them, and using just a touch-tone smartphone, they can log into this app whereby they can ask those questions, get engagement, get special promotions, which incentivize them to stay on treatment. So that's just one of the innovations that we have in patient solutions, and we've branded it in DKSH as P-Sphere. Another area is engagement with customers, and particularly, I would say pharmacies, clinics. Many of them would like to order online. It's much easier. It's quicker for them to do. It's much more convenient, less chances for mistakes. So we created our own platform called DKSH Connect. Today, huge part of our sales are done through electronic platforms, either DKSH Connect or electronic digital interface with hospitals and other large clients. So
Now,
it makes
Bijay,
it much smoother,
can I
easier.
interrupt you there and talk about then how this radically changes the whole process? Because traditionally, you have medical sales reps going around to each of these doctors, getting them with doing that missionary sales service, getting them to do order taking. And essentially, the medical sales rep is an order taker. Now, if the clinics or the hospitals are all ordering from you digitally, how has then the role of that medical rep evolved? And has this person's role diminished somewhat because of digital ordering?
Thanks for the question. So, in simple terms, we don't have sales reps anymore that are just order takers. Our sales reps are well trained. They understand the product. They understand the disease state. They can answer questions, and they can essentially promote the product. In certain markets many years ago, we had what you well termed as order takers. You understand the industry. That's basically become a dinosaur.
Fantastic. So I interrupted you. Please continue because I wanted to
No, no.
clarify that.
Thank you for asking. So, that's the second area. As I said, there's patient solutions, there's digital ordering, and then you start to see also on the back end, which is when clients want to interface with us, we have an easy order system and also what we call a client connect, where a client can, without needing to call a customer service or a client manager, can essentially, just like e-banking, understand what the status of an order is, whether they want something returned, they want to understand the inventory position, they want to understand a credit note. All of that can now be done seamlessly online. So, those are three areas that, from an external standpoint, we've digitized. And then, of course, we're on the journey of using a variety of automation techniques, from how we use scanning, how we use robotic process automation to take incoming orders. Can you believe that we get still orders on fax? We get a lot of orders on email in all different configurations. And for someone to manually reconfigure that into our SAP system, we found now we can get robots or bots to essentially do that for us and increase the level of accuracy and speed.
That's fascinating. Now, I want to zoom in on one particular area because that actually really helps improve patient outcomes. I want to talk about your patient solutions. Now, give us some ideas on how you've worked with your clients. And I was quite fascinated of when you were explaining patient solutions, how you've worked with your clients and how that has really impacted outcomes.
Sure. Thanks. So let's take a patient which has unfortunately has cancer. Let's talk about a very expensive treatment. It could be thousands of dollars a month. And unfortunately, many patients cannot afford that. That in Asia, there are only a few markets that have either full reimbursement or partial reimbursement. So many of the markets, unfortunately, patients can't afford the full price of that product. Clients are still very interested to give access to that patient, but they want the value of that support to go directly to the patient and not just be shared, let's say, with a customer. Could be the hospital, could be the pharmacist along the way. They really want to make sure that the patient is the one that's getting the benefit. In that case, we could run a program where we can check that, number one, validate the patient is indeed a validated patient through the doctor. Number two, they're a patient that had been prescribed that medication. Number three, they're a patient that's on that medication that's actually receiving it. But because of affordability reasons, they have a challenge continuing therapy. Let's say it's a therapy that needs 1 year of treatment to get better. The patient can only afford 6 months. That client may choose to have a program that the patient buys a couple, the client will provide a couple of months of therapy. So they want to see that this continues. We essentially help them log that is actually occurring. So we track the implementation along the way. Along the line, we understand which patients are more compliant, which doctors are participating in the program, and see the outcomes of patients, how they're responding. So that's a great example of where the client understood the challenge of that patient completing therapy was due to affordability. They want to partner with us on that program they cannot have, for confidentiality reasons, access of the patient information. There are conflict of interest issues. They use a third party like us. We manage it for them. The patient gets a better outcome. The patient finishes therapy for the full year. We can track and share what the outcome was of a patient that otherwise may not have finished the full year of therapy. That could be a very specific example for you of how patient solutions works.
And I can see it's just you explaining how that's really going to improve access and outcomes, particularly with access. Bijay, it's been a fascinating conversation, um, and you've really gave us a lot of insights. What's next for DKSH in 2024? We're start of 2024. What's happening with DKSH across the region and globally in healthcare?
Yeah, it's an exciting time. We're expanding. Organic growth has been, very strong. We are looking at opportunities for inorganic growth. So while I'm interested in expanding to additional markets, we have in healthcare expanded into the Philippines, Indonesia, and Australia, New Zealand recently. So we're very, very excited about growing our presence in those markets. We also have exciting markets like Vietnam, and Malaysia and Thailand, which are three of our biggest markets, which continue to see high single-digit growth. So, essentially what we see is patients looking for better and more access to healthcare, willing to pay for it in Asia. And, we're just super excited to provide support to clients who want to access those patients.
Bijay, I've learned a lot. Thank you very much for taking your time to be on the show.
Thanks very much to you. Wish you complete success, and hope your listeners who are interested in expanding their healthcare products in Asia reach out to us at DKSH. Thank you again, Brian.
Thank you. We've been speaking to Bijay Singh, the Global Head of Healthcare Business Unit at DKSH. I'm Brian Fernandez, and you've been watching and listening to Biztech C-Suite Conversation Show. The show will be on our website, www.biztech.asia, as well as our syndication partners, TV stations, radio stations, and websites. Thanks a lot for tuning in.